On the 17th of November 2019, a 55-year-old man lost his life to a new disease in Wuhan, China. Until that day, most of us had never even heard of Wuhan, nor could we predict the horrific deluge that would ensue from that solitary death, engulfing the whole world in the terror and dread of COVID-19, turning the lives of millions of people upside down and ending the lives of millions of others in one fell swoop. And yet, in the wisdom that hindsight allows us, we might come to realize that mankind has been through all this before. Through quarantine rules and restricted movements, through vaccine skepticism, financial aid, and even food supply concerns. Yes, man has already borne it time and time again and survived. This short documentary will take us on a swift journey through the ages, not only to catch a glimpse of local life during past pandemics, epidemics, and various contagious diseases, but also to gain some insight into how our health authorities have tackled them across the centuries.
Greetings from Fort St. Elmo. I am Maria, and my job here is to take care of the archives of the National War Museum. Together with my colleague Vanessa Chantar, we will be discussing why records are not just dusty documents to be used by researchers of history. In fact, modern medical day professionals are using records from previous pandemics to help plan mitigation measures. They are using this knowledge in order to back up their decisions. Here at the National War Museum, we are lucky to have archives which, amongst other things, show what the public health sector in Malta did in order to prepare for war and its associated perils. In fact, these archives show that although a lot of things change, some things stay the same. And it is very important to understand the past if we are going to be able to deal with the challenges of the present and the future.
One of the earliest pandemics known to have afflicted Malta was the Black Death, which reached our shores in 1348 through trade with Sicily. Little is known of its effects on the local population, though the lack of hygiene and overcrowding rampant at the time probably exacerbated them. Much more information is forthcoming about the plague that tormented our forefathers in 1592 and 1593, leaving some 3,300 deaths in its wake. At a time when the Maltese numbered far less than today, that figure would have meant a staggering 12% of the population. But, as with all the woes of life, some good came out of that pandemic too. First and foremost, it triggered the Knights of St. John, who ruled Malta at the time, to develop a better healthcare system and adopt more effective quarantine measures. The setting up of a permanent lazaretto on Manuel Island followed in 1643, making the Maltese harbour one of the safest in the Mediterranean. The lazaretto came into good use some 30 years later, when Malta was hit by its deadliest pandemic so far. The plague that lasted from 1675 to 1676 sent 11,300 people to their grave and wreaked havoc in densely populated areas such as Valletta and the Three Cities. As the disease spread unchecked, more isolation hospitals were opened, measures restricting people's movements were adopted, and severe penalties, including capital punishment, were meted out to those who broke quarantine rules. Grandmaster Cotoner and the Council of the Order requested assistance from abroad, with foreign surgeons and doctors arriving within a month. Financial aid was given to the needy, while Mdina was closed to non-residents, and travel to Gozo was discouraged in an effort to contain the disease. Yet another major outbreak of the plague occurred in Malta between 1813 and 1814, causing some 4,500 deaths, or approximately 5% of the island's population. Once more, people were discouraged from mingling in markets, communication between sea vessels and the shore was forbidden, churches were closed, domestic animals were made to be kept inside, stray ones were killed, and shops selling food were only allowed to open for 4 hours a day. Several people were executed for concealing their infection. Interestingly, this plague and others preceding and succeeding it led to several small cemeteries, chapels, and niches being dedicated to San Roque, believed to have been healed from the plague through divine providence by a dog licking his wound. A painting of the saint by Mattia Preti also adorns Sarria Church in Floriana. The lethal Spanish flu was the next pandemic to hit the Maltese Islands, reaching our shores in June 1918 and killing 1.5% of the population. As before, several measures were put in place to limit the spread. Overcrowding in places of entertainment was prevented, government schools were closed, and the importance of cleanliness was emphasized, to name but a few of the preventive measures taken. Fast forward to 1935. Rumors of an impending war were rife, igniting fear of yet another pandemic. The health authorities did their best to prepare themselves for that contingency. Medical supplies were ordered in abundance, including stretchers and medicine, and would suffice until November 1942, when the Second World War ended for Malta. Lectures were organized for doctors in preparation for casualties of war. Beds were increased in hospitals in preparation for the expected onslaught, while nurses were also given special training. Some nurses were even sent for training to the United Kingdom, but did not manage to return to Malta before the war broke out. The aim was to improve the infant mortality rate, which at the time was the highest in Europe.
In an effort to mitigate the possible effects brought about by pandemics during war, vaccinations were offered against smallpox, typhoid, and diphtheria. However, the local population seems to have been quite wary of taking up these vaccinations officers, with only around 100 children being taken up for vaccinations.
Rats were a nuisance, which were very much on the agenda, being carriers of various disease, including the dreaded plague. The Maltese were very familiar with this disease, even though the last outbreak had happened 100 years before. As a precautionary measure, the health authorities carried out a rat survey, where they tested rats for the dreaded disease. A similar survey was also carried out for mosquitoes, as malaria was another disease which the health authorities wanted to prevent at all costs.
Tests were not limited to animals and insects. Several people, considered to be possible carriers of various diseases, were also examined to ensure they were in good health. The health department also performed regular tests on foodstuffs and water in order to prevent typhoid and other food-related maladies. Throat swabs were another common occurrence. During the Second World War, they were one of the means to check for diseases such as scarlet fever. One might say that the practice of testing and swabbing in hopes of preventing the spread of disease is a strategy which the Health Department of Malta has always favoured. Connaught Hospital had been set up in Mdina as a hospital for infectious diseases at the beginning of the 20th century. It was commonly used to treat tuberculosis. As the war progressed and food became scarcer, the population became more malnourished and cases of tuberculosis increased steadily particularly between April and June of 1942. It wasn't long before the health authorities were facing overcrowding issues at Connaught Hospital. Another common ailment related to lack of nutritious food was scabies. Preparations had also been made in the likelihood of a surge in mental disorders brought about by the war. However, this prediction did not materialize, as the increase in patients at Mount Carmel Mental Hospital as a result of war was negligible. This was a lucky break, as the hospital was hit multiple times during air raids, probably owing to its proximity to Ta'ali airfield. Then, as now, burials fell under the remit of the health department. During the war, this was another headache, as the location of the Adeloratus cemetery was a potentially dangerous zone, frequently targeted by the enemy. Arrangements were therefore made for burials to be held in disused cemeteries.
Indeed, underground shelters were a godsend, and the reason why the number of casualties was much lower than expected. Unfortunately, conditions inside the shelters were not particularly good, especially at the beginning of the war, where not enough shelters were dug to accommodate the whole population. In an attempt to avoid overcrowdings, more shelters were being dug while the war raged on. In fact, by 1942, although more than 2,000 shelters were dug, this was not enough. In fact, the authorities were also encouraging people who could afford to dig their own private shelters. Since people were spending whole days inside of shelters, sanitary facilities had to be improved. This meant that wash basins were found, and also a maternity cubicle were installed. Women that were pregnant and unfortunately had to give birth in the middle of an air raid had now at least some sort of privacy. This was not an uncommon event, even though birth rate kept decreasing until 1943.
The system seems to have worked, as no cases of sepsis were reported, even though the shelters were notoriously humid and dusty. To further emphasize the priority given to cleanliness by health authorities, shelter cleaners were employed, each responsible for keeping 8 shelters spick and span. In addition, health inspectors made regular visits to every public shelter, ensuring that they were disinfected from time to time in an attempt to keep sickness at bay. A call for shelter wardens was also issued. Their main responsibility was to check that all those who sought refuge in the shelters abided by the regulations issued by the health authorities. However, the wardens were volunteers, which brought about its own problems. In their defense, it was quite difficult for warders to enforce rules, especially during the chaotic days of 1942. The health department tried its best to give them a helping hand by disseminating information as to why shelter rules were issued and were to be obeyed. Health slogans were even stenciled on the shelter walls, even though illiteracy was still rife at the time. Another area of concern for the health department was the considerable number of diabetics among the Maltese population, making insulin in high demand. This problem was partly solved thanks to the heroic officers manning the submarines that crossed the Axis-infested Mediterranean to deliver emergency supplies to Malta. These included the much-needed insulin as well as disinfectants. Leaflets for diabetics were also issued in 1942, advising sufferers on how to cope with the limited food rations available. Health authorities remained highly vigilant against epidemics throughout the war. The long-anticipated outbreak occurred in the summer of 1942, when sewage pipes were hit in the Ta'ali area and typhoid ensued in the surrounding villages. The authorities dealt with this calamity by making the typhoid vaccine mandatory in March 1943, in the parts of the island most affected by this contamination. The vaccination program appears to have been very well organized, with lists of vaccination locations and times published in the government gazette. The newspapers of the time carried plenty of letters protesting against vaccination enforcement. Some were skeptical about the vaccine's efficacy, whilst others reiterated that compulsory vaccination infringed upon their personal freedoms. Many debated the pros and cons of taking the vaccine. Another bone of contention involved the use of sick leave in case of any side effects following vaccination. Some employers allowed their workers a day off after being vaccinated, but others were not as accommodating. As expected, it was the weakest members of society who suffered most from the deprivations of war. Mortality was highest among the very old and the very young. In November 1942, infantile paralysis, commonly known as polio, broke out, reaching its peak during the Christmas period of the same year. Patients were treated at St. Vincent de Paul Hospital. Schools and places of entertainment were closed down in the beginning of January as a mitigation measure which had the desired effect. They were reopened just 1 month later, on the 8th of February. The situation in Malta started taking a turn for the better in 1943, as reflected in the Health Department's statistics. The birth rate regained momentum, and several charity drives were organised in the United Kingdom to contribute to our health system, as an affirmation of the British government's appreciation of the Maltese people's resilience during the siege of Malta. A scheme named Adopt a Village was even introduced, whereby localities in the United Kingdom would each sponsor a village in Malta.
With the immense advancement of science and technology that the world has witnessed since the Second World War, we have had a greater sense of security, at least before COVID-19. With state-of-the-art machinery in our hospitals, our doctors' vast knowledge, and top-notch health services, who would have thought that a microscopic virus would have brought the world to its knees? Unfortunately, this is a reality which we are still facing day after day.
And the greatest irony of all that is that despite science's huge leaps and bounds, the basic precautionary measures taken by our forefathers still hold true today. We have observation of quarantine rules, strict social distancing, vaccinations. They would all have sounded very familiar to our ancestors. And this also goes to prove that despite the passage of time, human nature is one, and still the challenges faced by the past are ones that we are still facing today.
What we can hope for is that history's lessons are not completely wasted on humanity, that we have learnt to have more faith in science and in the expertise of our health authorities, and that ultimately, pandemics are life's way of showing us that nothing is permanent. This too shall pass.